And as the pandemic continues to affect residents in Maryland and across the country, the price of medical care also is becoming increasingly a concern for patients. WDVM's Katie Rhee tells us about resources that can help those struggling with medical debt.
These past 20 months have shown us just how important medical care is, but even more so, how expensive it can be. And Senator Chris Van Hollen wants to help Marylanders who are struggling with medical debt and who might still be uninsured. And according to stats from a 2020 medical debt poll by Gonzalez Research for the Maryland Consumer Rights Coalition, shows just how many Marylanders are still struggling.
We found that 21% of African Americans polled had medical debt they were unable to pay, and 7% of white Marylanders had medical debt they were unable to pay. We further found that about 24% of African Americans in Maryland delayed seeking health care because of cost concern, and 12% of white Marylanders did the same.
The virtual forum highlighted legislation and resources at the state and federal levels currently in the works. And they're working to protect those facing financial struggles, like the Build Back Better framework and the Maryland Health Benefit Exchange.
A key part of the Build Back Better agenda is to reduce the financial squeeze that American families, Maryland families are experiencing in so many different areas. Well, if we can reduce the costs of health care up front, obviously we are going to reduce that problem.
According to a study done by the Kaiser Family Foundation, 28% of Marylanders are eligible for Medicaid, and the open enrollment period for health care coverage is still open. And if you want your health care coverage to start on January 1st, so the very first day of the new year, you must register or change your plan by December 15th. Reporting in Western Maryland, I'm Katie Rhee, WDVM 25.